Well, Erin, I'm so excited to bring you on to Core Connections today. We're going to talk all about hypermobility. We're going to talk little bit about Ehlers-Danlos syndrome because I know I have people in my audience that are dealing with that. So, welcome.
Great to be with you. I'm excited to talk about this topic that it's near and dear to my heart and actually is a key part of how I address patients with chronic health issues is actually looking at their connective tissues and how it connects with everything else in their body's physiology. So it's kind of something I do on a daily basis. So I'm
I love it.
excited.
And yeah, and I was so excited to bring you on. And when I met you at Mindshare last fall, you literally the first person I ever heard that's really helping to bridge this gap of like the connective tissue and other things within our health. And since my background is movement through and through, but also as an FDM practitioner, I found what you do very, very fascinating. So let's get on it and let's get going. So let's start off with like, what is hypermobility? How can it be beneficial? And also, how could it be risky for people who are super hypermobile?
Yeah, well, it's a spectrum, and so hypermobility actually is a survival benefit. So when your joints are a little hypermobile, you can actually run a little faster, you can jump a little higher. People think about individuals like Michael Phelps, who literally he's already a tall guy, his arms are longer than he is tall, fastest man in the water. People like Usain Bolt. I remember watching. It was a national volleyball championship. It was Nebraska won that year, women's volleyball, and the ladies won it, and they all were like excited. They're sliding on the court, and you could see like throughout the facial features, their fingers were longer than the palms. They were all W sitting, right, as a college ladies, right. And I'm like, this is a bunch of hypermobile women who can get a little higher, and they're national champions. And it's really interesting how it actually is a survival benefit, but in the wrong place, the wrong time, the wrong environment, toxins, trauma, a bunch of things it can set you up for chronic health issues, which is kind of how it plays in my practice. Hypermobility is kind of tricky because people will Google it and they automatically go to Ehlers-Danlos. Ehlers-Danlos is it's not as rare as people think it is. It's in the medical world we like to say it's not uncommon. You
Okay.
know, it's not uncommon. You're like it's not uncommon, so it's not uncommon. Yeah, I guess that's basically what I say. But so I see that probably on a weekly basis in my clinic. Ehlers-Danlos is one type of severe form that people tend to go to, but hypermobility in general affects all parts of your physiology. Your connective tissues connect everything. It does have survival benefits. I don't want to talk about that because I see people with health issues. But when you have a dysfunction in your connective tissues, it affects your body's electrical system. It affects your gut by the way the connective tissues hang your bowels and your GI tract. It affects your pain. It affects how you actually hold your joints in place. It affects your body's energetics. It has a wide range of effects on your whole body's physiology. And understanding how hypermobility plays in with chronic fatigue and pain and fibro and with mold and Lyme and all these other brain systemic inflammatory issues. It changes how you address their other symptoms. And you were mentioning before we started recording how when you deal with people's connective tissues with posture, they get better. And like that's like yes, because if you're always stressed, your cortisol is always high because you're freaking out because your joints are slipping, you automatically have a high cortisol state, which affects everything. So it's really interesting how the connective tissues literally connect to everything else.
Everything. Yeah.
Yes.
Yeah, I love that you said that because I'm like, as you're saying all this, I'm like, hopefully everyone listening is like, yes, this is making so much sense. Erica's always talking about fascia and how everything is interconnected in the body. So, okay, so let's talk about, connective tissue and really what our connective tissues do. And you said something like I really would like you to hit or a little bit more on this is the digestive system and how because again I work with a lot of core function, right, and digestion is always a part of that. And I always notice it's like, okay, we need to do the movement pieces to teach the body how to be more connected and stronger and more stable, but we also need to work on the digestion. But how could hypermobility be working against our digestive system from that perspective? I guess explain that a little bit.
Well, the thing is, you get this thing called ptosis, and ptosis is just organs kind of sagging. And so you mentioned before we started recording, you deal with women with pelvic floor dysfunction.
Mm. Yeah.
That's another place you see ptosis, especially after having babies, things just sag. Well, imagine that being in your guts automatically. So it affects motility. Your bowels move a little slower. And basically, depending on your physiology, you can develop SIBO, which is small intestinal bacterial overgrowth, more easily. That can affect digestion. You also tend to have a little bit, because of the some of the bacterial abnormalities in the gut, tend to have a little bit of lower pancreatic function. So these people need more pancreatic support. Um, the other thing that plays into this is actually people with hypermobility, because of their body's nutritional needs, they need more collagen, they need more vitamin C, they need more trace minerals like zinc, they need more vitamin A for their gut lining, they need more B vitamins. Well, they so all of a sudden they automatically are kind of wired for these deficiencies. But basically, it's like, the way I say it, it's like how you're a high performance athlete. You're like a Maserati. It's a good looking car. You can hear it from a distance. You push a pedal, like zoom, zoom. My son's hypermobile as well. I tell this to him all the time. But if you don't take care of them, they break down. They're really expensive to fix. And so, because of this performance kind of thing, people tend to have more of these nutritional deficiencies. And all of a sudden, all these vitamins I mentioned affect gut function, and they affect mucosal barrier. Motility affects small intestinal bacterial overgrowth. It affects dysbiosis. And so it's almost like these individuals tend to come along with gut issues just as a part of who they are. Another thing about it is, um, when you have hypermobility, you actually need more movement to help with digestion. Movement's an important part of digestion. If you have a dog, you let your dog outside. What's your dog do? Runs in circles and goes to the bathroom, right? Because they're sitting around all day long, right? And so it's interesting how we as humans actually, what if if you have constipation, right, or gut issues, drink more water, eat fiber, and move more, right? But people with hypermobility, they need that even more. So all of a sudden, being sedentary, not being physically active, all of a sudden the digestive issues that most Americans are dealing with and the lack of motility are a bigger issue with people that are hypermobile. So it's not just the mobility stuff, it's the nutritional deficiencies, it's the low-grade pancreatic insufficiency, and the low-grade dysbiosis or SIBO, which just has this feed-forward cycle. And all of a sudden now, was a little gas and bloating 10 years ago, now becomes food sensitivity, and then 10 years from now becomes an autoimmune issue. And so it's like these people are kind of primed for that, and it becomes one of the major things you have to work on with their health. It also means certain things like manual manipulation, visceral therapy can be really helpful for these individuals. There's certain physical therapists that specialize in visceral manipulation through the abdominal wall. There's certain therapies that actually become really helpful for these individuals to help with their motility issues. So this informs also how we address their gut issues based on their symptoms.
Yeah, it's so interesting. And I teach a lot of with the fascia, right? So much addressing the fascia. And with the soft ball, I teach ladies how to actively like kind of work the tissue in their core very, very gently and doing like manual stomach massage on their bellies inside my core rehab program. And it's amazing how many women are like, just doing that on a regular basis has like transformed their digestion because they just needed that little bit of extra assistance to help to really help get things moving. So it's very, very fascinating. So Erin, what are some of the illnesses that you see associated with hypermobility? And I also want to make sure we talk a little bit more about Ehlers-Danlos and like what that is. And just because again, I get a lot of women that find my core rehab program and they have Ehlers-Danlos, and it really does help them again because we're working on the stability piece of it, which is a part of it. I know there's more to it, but
Yeah.
that's a part.
Well, there's this thing called, there's two things. One, there's this thing called the Pentad super syndrome. And it's five things. If you see one of them, you have to look for the other ones. So it's POTS or dysautonomia, which is a blood pressure regulation disorder. It's basically a gut brain vascular problem, autoimmune issues, gastrointestinal tract issues, mast cell stabilization, I'm sorry, MCAS, which is when people talk about they have like histamine issues or reactive issues or weird stuff, a lot of times it's actually falls under the MCAS rubric. The thing that connects all these is hypermobility. So if you see a patient with POTS or dysautonomia, which actually is super common, you see someone with an autoimmune issue or gut issue, um, or MCAS stuff, which can look like chronic fatigue, fiber, it can look like chronic alignment. A lot of mold patients will actually present with MCAS stuff. All of a sudden, my thing is you have to prove to me you're not hypermobile. Okay. So, because I'm automatically assuming you are, right? So that goes right here. The other thing about hypermobility that's really interesting and how the whole mind body aspect is people that are hypermobile have a 400% increased risk for being neurodivergent. Okay. So neurodivergency is this group of a lot of things. It's ADHD, OCD, autism, pandas, PANS, just Asperger's. A lot of my patients, it's actually also empaths. I'm not sure if you know what an empath is.
Yeah.
It's women who can like, well, men and men, but tends to be more women who it's like it's a sixth sense. I'm an anti-empath. Like I can tell emotions by looking at facial features and body stuff, but then my wife can like literally like read the room. Some people are so empathic, they call themselves clairvoyant because they can literally feel emotions in a room. And what happens is, again, this is a survival thing. It's part of that heightened sense of alertness, awareness of your environment. But if you have a trauma, physical, emotional, sexual abuse, terrible relationship, concussion, head injury, or your chronic health issue cause a trauma-like response, all of a sudden now these people's brains are more likely to be in this fight or flight situation. You have to rewire your brain. So all of a sudden, it's not just the body and the fascia, it's that mind-body connection, which is really interesting why I like certain things like Tai Chi and Qigong for these patients, because you're really getting the body and the fascia with breath work and mind work together has an amazing, amazing calming impact on some of these women. I'm kind of curious actually, Eric, if you've noticed that in your clients or people you work with, like they tend to gravitate to those kind of things because that's been my experience.
Yeah, I mean that's my core rehab program especially. It's very mind body, or I say body mind connection, because I make her slow down and really pay attention to the cueing that I'm telling her and her breath work and all of that. And sometimes, because I tend to attract a lot of women who want to be very active, right? Because again, mobility is so important, right? Staying strong as we're aging and all of that. But it's very interesting how once I can help them get over that initial kind of mindset shift of it, you don't have to be kicking your butt. You don't always have to be getting a sweat on when you're working out. It can be really, I call it nourishing for your body. Then once she starts to shift her mindset into that, she starts to get such better results. And a part of that is, I mean, there's like so many factors, but a part of it is like you said, is because, well, so many people are living in fight or flight. And so by becoming more connected within her body, she can help to calm her nervous system. So it's like there's a lot of pieces going
Yeah.
on, but it is time and time again, I hear from my ladies, it's like, they're like, oh my gosh, like I'm slowing down now and I'm actually connecting with my
Yeah.
body and I'm paying attention to what's going on. And they're like, I feel so much better. And she's
Yeah. It's
doing
just,
less and it's more
yeah.
effective.
Well, because of that whole mind body aspect and because of that heightened sense of awareness, this group of people, they like that whole your personal self-regulatory practice, it's even more critically important than it is in regular people. Like I can go and not sleep and I'm okay. These individuals, they do that, they crash and they burn, and so they really, it's almost like they feel better when they find that nice medium where they can actually do their self-regulatory practice with prayer or meditation or a body art or my wife loves painting. And just get in a space where it allows their body to hyper focus on something and go into like basically that gamma sympathetic, intuitive creative aspect of the brain, which you can't get there if you're like your brain's thinking, when's the next shoe going to drop?
Yeah. Okay. It's so interesting. As you're saying all this, I'm like, I've never thought of myself as like a hypermobile person because I've worked with hypermobile people and I am not an extreme hypermobile person. And I'm like, Aaron, you would probably do an analysis on me and be like, Erica, you are definitely
Uh,
in the hypermobile category, even
no.
though I may not be an extreme hypermobile
Well,
person. It's so interesting. I don't know if you want to speak more to that, like this, the kind of the
well,
spectrum of the hypermobility.
what's funny? So, like, Ehlers-Danlos is extreme. I mean, Ehlers-Danlos people
Hmm.
are dislocating, you know, hips and shoulders and, having, a cervical outlet syndrome where they're compressing neurobundles and arteries and all kinds of crazy stuff, and their brain slipping on it's just crazy stuff, right? But the thing about it is there is a spectrum. And so it's really interesting. In the UK, they consider a kid with a Baton score of 4 to be hypermobile. In the United States here, we have 5. So it's really kind of interesting to me that, like in the UK, their criteria for hypermobility is more generous than ours here. But the problem with the way the medical system scores it, it's for research purposes only, and that score is called a Beighton
Mm.
score, a Beighton. And I actually took this and made my own scoring system based on some other things I'm going to talk about real quick. But the
Yeah.
problem is it focuses on your upper extremity, right? So, your fingers, can your thumb bend down, your pinkies, your elbows? That's six. Yeah. Well,
You're
it's
like,
not
you're
the
like,
thing.
yes, you're
Yeah.
hypermobile,
Well, your
Erica. Yeah.
fingers, but look at the way you move your fingers. It looks like your fingers are longer than your palm, which is one of the soft criteria. And your
Interesting.
palms. Well, here's the thing. Okay, listen. So,
I have weird
um,
thumbs, but
yeah,
there's that.
there's criteria one and criteria two. And to get to criteria two, you have to do criteria one, right? The problem is criteria one, it's just your thumb, just your pinky, just your elbow, just your knees, just can you touch your palms on the ground? My son doesn't meet that criteria, but he can turn his back, he can turn 180. He can literally look backwards and crack his
Mm.
whole spine.
Oh, wow.
It's just like
Okay.
his spine is hypermobile. So the problem with our scoring system, it doesn't look at the soft things. Like when I see a patient, I can touch their skin and it has this feeling to it. You look at someone's face, they have a more narrow face, a little narrow dental arch. Tend to have a more of a high arch palate. They have a little narrowing of the lower jaw. With their fingers, they curve back like yours do, which sorry, like mine go like that. I'm like super unhypermobile, and you just flexed, and your muscles pulled your fingers back too far. Yeah,
Yeah.
that's yeah,
So
that's the
interesting.
point
Okay,
is that
so you can be can so again, right? You can be hypermobile because I think of like my son, for instance. I look at him and he's to me really tight. He's got a lot of tight
yeah,
fascia. We actually have, I feel in my family, maybe it's more on from my husband's side, like we actually have some restricted fascia. I actually have, well, I have my family members too that I look at them and they're very restricted. But some of the things you're saying, like the high palate of the mouth and like
yeah.
some of these things, and I'm like, but so can you be both? Can you have restricted fascia in some areas and be hypermobile in others, like you said with your son and his spine?
Yes. The answer to that question is absolutely 100%. And that's part of it that you have to know. So one of the things
Mhm.
your body does is because of the hypermobility and the micro injuries that occur, your fascia starts to tighten down with time. So what happened is when you have lots of fascia, like in your back, for example, or your hamstrings, people are really super tight there, but places that are more just joint, like your elbows, your fingers, they're actually hypermobile there. So actually fascial. Another thing, when people get like, they'll see like a chiropractor or have some work done, they just don't
Mhm.
hold. They just don't hold on
Yeah.
to it really well. That's a marker that their fascia actually is a little loose. And part of the issue, and you're probably familiar with this, is the fascia are packed full of nerve endings. Okay. Now, if your fascia are a little loose, what happens is you kind of it affects your proprioception, which is your body's ability to feel self in space and time. So I like to think about if I close my eyes, I can kind of know exactly where my finger's at. If someone's
Mhm.
hypermobile, it's more like you have Mickey Mouse hands. Okay. You don't quite know where they're at.
Mhm.
Now, and the cerebellum in these individuals are a little bigger as well than cerebellum in regular people. But if you have a bigger cerebellum and you train it, you can actually have more coordination if you train it. If you don't, you're the big lanky person who bounces off the walls, who's clumsy, right? So it's really interesting. You look for these subtle things, but one of the things that can happen is their fascia do restrict themselves as a protective mechanism. And that can be in the back of the head, the spine, they can be the hamstrings. Any place you have big fascial bands, you can actually have restriction, and it's your body's coping mechanism. And that's one of the things why sometimes myofascial stuff for these people works really well. It's one of the reasons why craniosacral work can work really well for these people. Sometimes acupuncture. There's a lot of different things that actually, because fascial component is part of it, and it's being clinically seen as restriction, is actually paradoxically part of the hypermobility, and it affects
Is-
how you deal with them.
Yeah, I'm glad you said this. I was actually gonna ask you about that because what I see a lot with fascia is compensation. Like the body is
Uh,
it's its
Yeah,
protection mechanism because they don't have enough support from that area
yeah,
and other areas. Like I always say, like the low back, for example, right? People that have low back pain and they're always going to someone to like adjust their low back constantly, right? It's never staying. It's like, well, it's not your low back's fault. It's because we have to address what's going on with pelvic floor function, deep core function. How is, what's going on with your hamstrings, your inner thighs? How are you walking? How are you standing? How are you breathing? It's like all the things. And so that was, I guess, my biggest thing I wanted to address with you was like with the compensations. And so someone can technically actually be really tight and
yeah,
restricted, but still be very hypermobile, which
yeah.
again kind of sounds contradicting itself, but I say
Yeah.
stuff like that all the time. So I totally get
Well, and then the dance, it's interesting the dance world. So in the dance world, if you have a kid that's hypermobile, and it's amazing how many people with EDS actually work through it and they do a lot of core stuff and can actually compete at a professional level. And that I didn't until I did some training with some PTs and other physiatrists at the that are at the level from the companies and the dance companies in the UK.
Mhm.
I didn't realize people actually could compete at that level. But what happens is these are the kids that are like 12. When you're 12 and they're hypermobile, they're the kids doing the scorpion, if you know what that is. It's when like the kids'
Mhm.
feet come over their head and they yeah, and they do that kind of what happens, those kids when they go to point on time, right? And what happens because they don't have the muscular strength, those kids actually get injured out of the system. And so what happens, they have to super focus on muscular strength building in order to be able to do things like go to toe and to actually be able to hold their figure. So those kids, if they're with really good trainers, will actually hold them off on things like toe and hold them off on some things until they build enough strength and core stability, and not rely on fascia and not rely on joints to hold these positions. And then what happens when they get to like the professional level, they have to realize their body's limits and they always have to work on core so they can do those flexibility things because they do these beautiful arches. Their body wants to overextend them and they have to say, no, I'm using the muscles
Yeah.
to hold it in place and not use your joints and your
Yeah.
fascia for stabilization. So the idea of passive versus active range of motion, passively stretching is horrible for these people because it actually uses the joints and fascia and they have to train their body to do active range of motion, which is you need core muscle strength.
Yeah.
And so the ones that get into sports, like more like gymnastics that actually focus on that kind of stuff, tend to get less of the weird dislocation stuff versus ones who get into sports that rely more flexibility because those kids tend to, and a lot of people aren't educated, they tend to use the joints and the fascia for range of motion, which ultimately ends up in lots of injuries.
Yeah, it is that stability. I'm all about like it's the active, you've got to be connected through your stretching. I teach that to everybody, whether we're talking about hypermobility or not, because otherwise we're
Yeah.
just leading to those continual overcompensations in the body. So that's awesome. It's great. Um, okay, so what are some of the things you kind of talked about a lot of things. I almost feel like I want you to bring those back up because just as an awareness thing for people, you said there was like those kind of five criteria things that can tend to come up with people with hypermobility. Can you mention those again? And then what is your recommendation for, if anyone is like, oh gosh, that could be me, where do we go next?
Well, well, I feel like, in my clinic, I'm a different place because in my clinic, I see a lot of people that are really sick and have
Mhm.
mystery illnesses and have been to like 15 doctors. But my passion is actually to find the kids that are hypermobile and give them the nutrient dense diet. Like these kids would be horrible vegans. Like these kids need more protein per kilogram than a standard person. They need a lot more protein. And so it's like, and you gotta get this kind of protein that has a lot of it's collagen rich. So like collagen based proteins, bone broth. They need more trace minerals in their diet. So just like knowing that for those kids, these kids on a standard American diet, that's nutrient deficient, that's nutrient depleted, with a lot of rancid oils and fats. Like these kids really, they're Maseratis in the making. And you have to
Mhm.
realize that you can't give that body poor quality nutrition. The environment becomes a big deal with these individuals because it's like if you, it's a little harder for these individuals to detoxify. So living in a moldy building, living
Mhm.
in an environment that's not safe because again you're more prone to that stress response. So it's just like for a parent making sure you have a really like obviously kids are stressful and marriage is life is life, right? It's like but just like no more stress than we absolutely need, right?
Yeah.
But I tell a lot of my younger patients like don't get in relationships with tra- you know people that are traumatizing. It's amazing how many times that sets your brain in this fight or flight thing, and that's just like prevention mode. The five things you were talking about, like when people come to see me, again, it's
Yeah.
the gut issues, autoimmunity, which is kind of sort of everywhere,
Mhm.
positive dysautonomia, which in kids can look like ADHD. In adults, it can look like anxiety. It can look like you wake up in the middle of the night with your heart racing. It can look like I feel like I'm gonna pass out, feel dizzy, or it's hot outside and your energy gets drained. POTS is often misdiagnosed as a psychological thing, not a blood pressure regulatory thing. Um, Muscle activation syndrome, it's kind of, we don't have time to kind of go into it, but it's
I know.
basically, it can look like people with mold and people with Lyme and people with a lot of other weird things, when you kind of dig into it, and they have all these crazy reactivities that they react with everything, right? I can't, smells mess me up, and food, I react with everything, and water, I get reflux with water. A lot of those people have a mast cell component. The way I explain it to people, it's part of your nervous system. It's like your nervous system reaching out through parts of your immune system called mast cells into every tissue in your body. So it's this crazy way where these sentinel, it's almost like sentinel cells of your neurological system, but are actually part of your immune system or in your tissues. And if they get activated, they can literally communicate right back to your brain in a heartbeat, warning, danger, danger. And unfortunately, once they're kind of activated, the response can be a lot of weird stuff, skin rashes, buzzy, tingling feelings, just a bunch of weird kind of stuff, mood swings, almost kind of like sometimes it can actually look like semi-psychotic bipolar kind of stuff. And it's literally just your brain's on fire. There's like that aspect of it. Then there's the mental health aspect I mentioned before. But what
Mhm.
happens is with any kind of um health issue that relates with nutrition, protein and macros, micros like vitamin C, trace minerals. Okay. And one thing I talk about a lot, which I want to mention here, people with hypermobility are more prone to have sleep apnea.
Okay.
And
So
that's
why is that?
because they have narrow pathways with floppy tissues. And so the anesthesiologist or the dentist referred to it as upper airway resistance syndrome. Your upper airway is just a little smaller. But what that translates into is you have a whole group of people who think they sleep okay, but they're actually not getting the quality sleep they need, that then affects absolutely everything else. So all the patients when I see in my clinic who have these health issues, if they're hypermobile, I check them all for sleep apnea. And today, probably 60 to 70% of them test positive. That's a big deal because
Yeah, it is.
like if I'm in my world, I'm supposed to check 50 people and I pick one disease up, right? If I'm looking at, you know, 10 people and find five or six that are positive, it tells me this is being missed everywhere. And it's amazing how often low-grade sleep apnea. I personally actually have a little bit of this low-grade sleep apnea, not because I'm hypermobile, just because I have it. But it's interesting. I started treating it when I was 45. I started to dream. I stopped grinding my teeth. My jaw pain
Mhm.
went away. My gum recession went away. And what clued me to it was I grind my teeth.
Oh,
How many
interesting.
people grind their teeth, right? And the answer is like a lot of people. So
What?
all of a sudden, if you're hypermobile and you have any cortisol, whatever kind of issues, health issues going on, you really should consider getting at home sleep apnea test. There's lots of ways to treat it besides the thing, the CPAP masks. There's a lot of different ways to treat it, but that can be a big part because the foundations of functional medicine are diet, exercise, sleep, right?
Yes. You can't
Meditation, yeah. And so
you
if you're not getting
can't
that
skip
quality,
out on you can't skip out on sleep. I see it with my clients too, and I'm like the
yeah,
clients who really prioritize their sleep, like they just get better
yeah,
faster than the ones who have a hard time prioritizing and getting on a good sleep schedule. It's like it's the sleep that's like the can be a missing piece. Just an interesting thing. I had my tongue tie and a lip tie released 2 years ago,
okay,
and my breathing massively improved at night. And I've done it with my kids, who two of the three never ever as babies were diagnosed with it. And it's massively improved the way their jaw and all of the structure of their face and their breathing and stuff. So it's very interesting. I just only because personally I've gone down a deep, I've talked a little bit about it on the podcast, but I'd be really interested because, like you said, with hypermobility, there's some of these check boxes. I would be curious if you started to see tongue ties in even your adults. It's very
so
interesting. And you can't
so
just
how's
release
that
it. You
how's
got to do all the therapy and stuff with it. But
question is how's that diagnosed in an adult? Because for my pediatric experience, it revolved around speech and feeding. How's
mhm.
that diagnosed in an adult? Just looking at the band on the tongue, or
So
is it how far
they take you through. So there's the oromyofacial. They are specialists in working with tree training the mouth and the tongue, and they work with a lot of kids. I mean, they mainly work with kids, right? But they also work with adults. So they'll take you through all these different exercises and they'll look at your posture and evaluate different things. And I didn't even know that I didn't really realize I was as much of a mouth breather at night as I was until I had my tongue tie release. And then I can tell that I suction my tongue because if you can't suction your tongue on the roof of your mouth correctly, it's because the fascia of the underside of your tongue is restricted down. And it's not just, it's like it can affect posture and everything. And it can also be what leads to a higher palate. That's what one thing I've discovered, because if a kid has a tongue tie, or say even an adult their whole life, that tongue has not been able to suction to the roof of the mouth and help to develop that nasal, opening the nasal pathway. So for me, that was my biggest reason in wanting to really do this, is as I was learning, just because I've gone down fascia rabbit holes, right? Like the fascia stuff really fascinates me, and understanding that the fascia of the base of the tongue actually connects all the way down to the pelvic floor. There is actually a connection with that, and I've seen massive changes with one of my kids that we had to do a second release because hers was really, really deep, and it was causing a lot of postural things that even all the stuff I was doing, we were kind of getting stuck spots. And so I don't know, it's very interesting. It's just an interesting piece when the kind of the stuff you're talking about. And it just is like one of those other layers that would be
Well,
really interesting. And I'd love to hear if you start doing that, like,
yeah.
let's,
Well, one,
what you discover.
one thing that's interesting about that is because one of the ways I will work on patients with mild sleep apnea who don't tolerate other things is actually with mouth taping. Because one of the things that happens when your mouth is closed, you close your mouth and you feel where your tongue is.
Yeah,
It's right behind your upper teeth. If you breathe through your nose, you feel the air go through. But if you open your mouth and you breathe, which many Americans do, you literally
right.
almost suck your tongue back. And so that's interesting how the tongue tie also might make you more prone to have that basically there. It's interesting if you just need 2 or 3 millimeters extra space in the back of your airway. That can be
Yeah.
the difference between sleeping well at night and having disrupted sleep. So
Yeah, exactly. Yeah. So it's been a
I'll
very
just start
interesting
looking. I'll just
journey.
start looking
Yeah.
for that. I see a lot of patients. You look in their mouth; they have a narrow dental arch. They have a far arch palate. Part of the grinding of the teeth that goes along with sleep apnea is they get tori or bumps in their mouth, which is your face structure changing because you're grinding your teeth. So
Mhm.
I'm going to start looking for the tongue tie in those patients and see um,
Yeah.
if
What do
I'm
you
noticing that as well.
do?
So
How do you get people to stop grinding their teeth?
we treat the sleep apnea. So if you're
Oh, okay.
but part of the reason you grind your teeth, it's your body's way of keeping your airway open. So when you're in REM sleep, right, your muscles go relaxed. You're like, and if you suffocate, then you wake up. So one thing your body does is like you'll start grinding and moving your jaw to like not do that, but you don't actually get into that deep REM sleep or quality REM sleep where your
Interesting.
muscles, because in
Yeah.
REM sleep, basically your body kind of like just gets paralyzed, right? And so but you kind of don't get there if you're suffocating when it happens. And so one thing your body does is just kind of start doing this stuff to keep the airways open, and that's how it affects your sleep. And then it affects facial structure. You can get people get will crack their teeth.
Oh,
Like I made cracked
wow.
teeth. Oh, I'm 40 and I've had 3 root canals in the last 2 years. I'm like, do you grind your teeth? Yes. Okay. Another thing with connective tissue issues, you make poor quality joints, et cetera, as well as teeth. All of a sudden, you're connecting people's root canals with their sleep apnea and their connective tissue issues. So it really
That
is all
is
connected.
okay. That is very fascinating. I have a client that I'm so excited to talk to you today because I have a client in mind. And like, as you're talking about a lot of these things, I'm like, I know she's obviously very hypermobile, but the teeth thing is something that she's dealt with. And so that's interesting that I don't know. It's so interesting, like connecting all these pieces together. And, I don't know. It's fascinating.
That's like kind of my you met I don't know if you met Becky at any of the mastermind thing. My wife, she's like, you're the connective detective, just like notice all the dots. I'm like, yeah, I guess that's what we do. But just amazing
Yeah.
how everything really is connected. And if you look, you'll find the connections. And when someone comes in, they say, I've got this undiagnosable idiopathic disease. I'm like, okay, someone just hasn't looked deep enough yet to
Yeah.
find out how it's connected with something else. So I don't want to forget to answer your Ehlers-Danlos question
Yeah.
before. You want to repeat it just so I can remember
Yeah,
how to
I
answer
just wanted
it?
you just it's more about, I guess I know you said it's more of the
Um,
severity of hypermobility, but I know you talked a little bit too about how, especially kids, they have it and they train their body the right way. So I guess talk a little bit more about like even for adults, right? Because I said
yeah,
I see people come into core rehab that have it, and core rehab does help them, and it's
yeah.
because they're creating more stability, right? We're working on the balance of the fascia, but I guess what else do you recommend? You said the food aspect, which what is the protein recommendation? I wanted to ask you that because protein comes up a lot. Like, what do you recommend people who are hypermobile or even do have Ehlers-Danlos? Do they need even more
Yeah.
protein to help with their connective tissue? What's your recommendation with that?
Women need, or I'm assuming maybe wrongly, I'm assuming most of your clientele are
Yeah.
females. Yeah.
Yes.
It's really funny.
Yeah.
Women actually need, one of the things we've learned in the last couple of years, women actually need more protein for the body weight than men do, period. And so it's just this radical, like, there's all these new diet weight, these things. It's just crazy, like how for detoxification, for hormones, all this kind of stuff. And so if you're hypermobile, you just basically ramp that up even more. Okay. But it's not just red meat. You need connective tissue. You need lots of phosphatidylcholine, which is a kind of fatty acid um, that's found in organ meat. You need connective tissue stuff. So that's where collagen comes into play, but not just collagen from cow skin. You want like a complete collagen. Um, in food, basically organ meat, eggs, and are the best source for this kind of thing. Traditionally, it's really funny when everybody's mom back in the day made bone broth at home. I remember watching her Leave It to Beaver episode when I was a kid, and literally Jen was making bone broth in the 50s on TV with a big shank. I'm like, this was so normal in a country in the 1950s that literally you'd see it on TV shows, right? And now people are like, oh my God, how do I do that? Like that, but you're
Yeah.
actually taking a organ extract that's lots of these micro trace minerals, and these trace minerals are super critical for connective tissue formation. So diet wise, you just need more protein. How much do you need? Probably a gram and a half to 2 grams starting per kilogram. If you're really physically active, it goes up from there. And that's almost like that's what we used to tell people. If you're a high competitive athlete, that's what you shoot for. I'm like, look, if you're a female that's hypermobile, that's kind of your starting point, but you want to have um, a higher amount of collagen in that, collagen-based proteins. And when you look at the fact that one third of all meat consumption pre 1950s was organ meat, it's like, how much do you add in? It's like, well, I don't know, more than what you're doing. There are certain supplements that are actually nice for this, but in my family, I just make bone broth all the time.
Okay.
We probably go through probably a gallon of it a week. We have leftover carcasses and meat and stuff we keep in the freezer, and then we just have it. Just it's super easy to use. So that's one aspect, nutrition wise. B vitamins, because of the gut issues, the absorption issues. If you check these patients' labs, it's just universally they have some B vitamin deficiency. So just a good B complex. Vitamin D's tend to be really low in these patients because of the innate inflammation. So it's like, I look at you, you look healthy, da da da. It's like, if you're not supplementing, is your D level like unusually low?
Yeah.
And it's super, super key. Yeah, there we go. Right.
Well, I
Right.
also live in Iowa where in the winter we get zero vitamin D from being outside. In the summer, I get plenty of vitamin D, but
Yeah.
even,
Yeah.
we're up higher north, we just don't get it, any vitamin
Yeah.
D
So,
even when the sun's out.
and then you need even more, right? So,
Yes.
so the B's are trace minerals, and then vitamin C, one of the key nutrients for actually making, scurvy is a severe connective tissue disorder, right? It's amazing how many kids are getting have low grade vitamin deficiency. The US RDA says, oh, you need 80, 100 milligrams of vitamin C a day. I'm like, yes, not to get scurvy.
Right.
That's it. That's all that dose is based on, is not getting scurvy. But if you're trying to prevent severe infections, you worry about, whatever viral things, chronic Lyme, COVID, whatever. You need probably 300 to 500 milligrams a day starting. If you're hypermobile, you probably need 1,000+ milligrams of a high quality vitamin C with other flavonoids in it. So that's like your basic nutritional stuff. But then it's like the
Do
gut
you,
aspect.
with vitamin C, do you recommend like liposomal? They're also then getting some phospholipids with that as well.
Yeah, but they're not enough. Like when you get
Mm.
liposomal products, the liposomes are just there to improve absorption. They're not the quantity. Like when I'm giving people some supplemental phosphatidylcholine. They're doing like a tablespoon of the
Gotcha.
stuff
Yeah.
every day. It's just it's just that's the problem with this as well. Like quantity of protein, quantity of trace minerals, quantity of lipids. You have to look at, you really, really, really have to look at food as medicine, you know.
Mhm.
Um,
Yeah.
you have to, there's this a mixed omega-3, omega-6 oil that I use that I make mayonnaise out for my family. So literally I'm using a omega-3, omega-6 balanced oil. My kids will slather it on eggs and sandwiches and stuff. And literally I'm watching
Wait,
them.
you make your own mayo?
Yeah,
Do you have that recipe somewhere? Can you share it with me? Because
yeah,
we
yeah.
go
It's
through
on my social.
mayo.
Yeah.
We go through mayo in this house like mad, and I'm like, okay, I never
So
thought about making my own, but that's a great idea
you
because then
make
it's
it, then you put the fat, you put the lipid that goes in
yeah.
your cells, and you
Oh,
need you want a 4-to-1 balance of omega-6s to omega-3s.
right.
And there's actually a product that has a balance. I use it one of those things, and you basically put your teaspoon of salt and a teaspoon of organic Dijon mustard and your 2 eggs and 2 egg yolks, then 4 tablespoons of acid. And my kids like 2 tablespoons of apple cider vinegar and 2 tablespoons of lemon juice. You put that in your thing. I'll take it. I'll make an aioli sauce sometimes. Put a clove of garlic in there, and all of a sudden it's aioli sauce. Put in
Yeah.
your food processor, pour the oil on top, and bam, it's a quart. Makes a quart of mayo. We'll go through that in like a week.
Okay,
That's how you.
I am doing that. So ladies listening, who else is making their mayo with me?
You can mix it up, add some more flavor, put some spices in it, however you want. But all of a
Yeah.
sudden now, for the healthy fats that you need, all of a sudden, Shazam, and using your food like your medicine. That's the way the protein has to be. That's the reason why you want bone broth. And these are your macros. Your micros, you don't have to, go crazy like that. But anyway,
That's awesome. Good stuff. I so appreciate it. So, okay, I know we talked about a lot of things. Is there anything that we haven't mentioned or talked about around hypermobility that you really wanted to make sure that you share with everybody?
the one thing I want to tell people is that people often ask me the hypermobility, you know, hypermobility spectrum disorder or benign hypermobility or whatever you want to call it, because the name will change. It changed 2 years ago. It's not Ehlers-Danlos. A lot of people look it up and they're like, oh my gosh, Ehlers-Danlos. Ehlers-Danlos is hypermobility to the point that you actually now have an illness where you're having chronic pain or fatigue, or you're having, dislocation where you roll in bed at night and you dislocate your shoulder or your hip, or, where you start getting prolapse of your organs, or you have these pain syndromes like where your neck actually have a little bit of movement of your scalp. It's actually called cranial cervical instability, where the head kind of moves a little bit, and you get compression of your the regulatory part of your spinal cord. Like that is Ehlers-Danlos, and those people have a lot of
Okay.
really weird symptoms. Require a whole lot of not just fascial muscle support, but nutritional. And by the time you get that stage, it's your brain's already been traumatized. 'Cause you're already in these fight or flight things. That
Mhm.
requires a lot more help. But when people go looking for this, that's where they go. And they don't think Michael Phelps, professional athletes. They don't think all these young. So that's where it's like it's the downside of Google. People go there. Oh my gosh, you got cancer. It's a brain tumor. You got EDS. Now there are a lot of people with EDS, and all of a sudden these therapies I'll mention have to become part of how their main issue might be chronic pain. The main issue might be, you know, um, POTS, which is really common in EDS. But if you're not doing all these other things, you're just putting a Band-Aid on whatever the
Mhm.
specialist is treating. And that's one of the things I see in my clinic with my EDS patients is they go to the pain specialist who gives people pain medications. They're not doing fascia work. They go and they're going to the psychologist for their bipolar and ADHD and all kinds of stuff. And it's like your brain literally is on fire. Taking
Right.
these atypical antipsychotics is not going to help that. Or they go to the GI specialist because their guts are wrecked and they've either got severe constipation or severe diarrhea, which you can have both or either. And they're not working on the gut motility. They're just giving them meds. And so it's really you have to connect it and bring it all together under one roof. And that's what I try to do. But again, just being hypermobile does not mean you have EDS.
Yeah. Thank you so much, Aaron. This has been amazing. Will you share with everyone where they can find out more about what you do, how to reach out to you with questions if they're interested in working with you? Because you are helping to put all the pieces together.
I mean, my website is basically the platform where all my educational stuff goes from, which is richmondfunctionalmedicine.com. or they could Google my name, Aaron Hartman, MD, and it pops right up. I've got over 200 blogs on there for information as well for people. I've got, the typical social media. It's at RVA Integrative. That's RVA Integrative, which is the name I practice in Richmond. And I believe my Facebook is the same thing. And then I'm on YouTube. It's just Aaron Hartman, MD. Um, but the hub for all my educational stuff is the website where I literally have over 200 blogs right now, and
Awesome.
the newsletter I put out is always telling people what new educational things that are popping up. So that's kind of my home base.
Awesome. Well, thank you so much. And will link everything up for you so it makes it super easy for everyone to find and reach out to you and just continue learning even more from you. So thank you so much, Aaron.
Thanks for having me on the show. Really appreciate it.